Hi everyone, good afternoon. My name is Molly Tobin and today I'll be presenting on my project which explored the perceptions and surprising lack of knowledge of BU students related to generic medicine. And this project would never have been possible without the help of my wonderful advisor, Richard Lang, who I'll talk about a little bit more here in a second. So just to kind of contextualize the project for you, I always find myself asking, why did people choose what they chose? So I just want to take a brief moment to kind of explain to you my thought process. So the journey kind of started when I studied abroad in Geneva the fall semester of my junior year, where I interned at the World Health Organization in the Essential Medicines department for a man named Richard Lang, who conveniently retired from the WHO and accepted a post here at the BU School of Public Health at the same exact time I was leaving Geneva. So lucky me, right? That really worked out because when I was thinking about my project, public health is such a broad topic. I'm a health science major, so it's basically public health. And I had no idea what I wanted to do, and this is kind of how I broke it down. So public health is really about health disparity, and that really comes from poverty and racism, and I'm super close to solving both of those problems, just not yet. So I moved on to the key issue of access, which is then really related to cost and how that creates a barrier for people getting care, getting medicine, any number of things. And cost can also be thought of in terms of health systems. Cost efficiency of health systems are a huge problem right now, especially in our country. Health expenditures rise every year and are the highest among all comparable countries pretty much. So that's kind of how I came to generic medicines, because believe it or not, the United States is actually very, very good at using generic medicines, and they've created a huge amount of cost savings for our health system. So I'll get back to that in a second. So just to give you a little background about generic medicines in our country, they account for 88% of all dispensed medicine. And since drug spending accounts for 12% of all healthcare expenditures, that is obviously a really great figure. So the Generic Pharmaceutical Association reported in the fall of this past year that we had record savings both in the past decade and the year of 2013. So $1.5 trillion saved over the past decade, which is huge. And this is kind of where that 88% number can compare to other countries. So keep in mind the 2010 figures are slightly outdated. The most recent numbers haven't really been published yet, so these are higher now, but they still don't really compare to the US's level, and they also still have a lot of variation among countries. So that's just a little snapshot for you so you can kind of see the discrepancy. And because of that discrepancy, I decided to look at perceptions of generic medicines. So if they are so great in terms of cost savings, if they are effective, quality medicines, why doesn't everyone use them? It seems kind of peculiar. So I wanted to do a study that really explored the perceptions of this product and basically tried to find out if I could illuminate any other reasons why this discrepancy exists. And I did that by surveying BU students. The goal was to survey international students, people who perhaps aren't international but spent a lot of time in other countries, or perhaps have immigrant parents. I'll get into that in a bit as well. But just so we're clear, my study did find, as my title gives away, a huge lack of knowledge. So I just want to confirm that we all kind of are on the same footing and know what generic medicines are. So this is the definition from the WHO. And in the United States, generic medicines also go through the same FDA standards for safety, purity, and effectiveness, and are chemically identical to their branded counterparts. So they're essentially the same medicine. The reason they're cheaper is because they don't have the associated research and development costs or the marketing costs that are associated with the name brand pharmaceutical drugs. So, like I said, my methods were twofold. I started by administering a survey to 164 respondents, and I targeted cultural or religious student groups on campus that typically have high populations of international students, or students, like I said, that have spent a lot of time in other countries, have a lot of family members in other countries, just to hopefully get that international perspective. And then I also did some qualitative research methods, an in-depth interview, round with 9 participants and a focus group discussion with 5 participants, which also used purposive sampling, which is basically when participants recruit more participants, just because they kind of have access to that circle. So here are the kind of main demographics of my survey. So you can see here, unfortunately, the vast majority of my survey respondents were US born. However, 28% did report living in another country. So this is showing which country that is. So about a quarter each for India, China, and Latin America, which were also the 3 largest countries other than the US that people were born in. So not exactly what we wanted, but since I was able to kind of hand select my participants for the in-depth interview and focus group, that did give me a more kind of well-rounded sampling of people from different countries. So this was kind of the main finding that surprised us from the survey. Participants were asked if they knew what generic medicines, were, just in a yes or no question, and 67% said they did. Those who said they did were then asked to explain their knowledge in an open-ended question, and we then graded those answers and deemed only 39% of the answers to be correct, which was really striking, especially given that so many of our participants were from the US, where we have such a high rate of use. You'd expect there to be pretty high knowledge of these products. However, that resulted in only 24% of actual participant knowledge of generic medicines. So these were the different prompts that were on the survey that kind of explored deeper into their perceptions. 1 through 5 used a Likert scale, so from strongly agree to strongly disagree. And then for number 6, we had different ranges relative to the branded price. So what is the most you would be willing to pay? I see some of you guys like craning to see that. Basically just saying like 2 times as much, 3 times as much, etc. So the vast lack of knowledge did have a confounding effect on our different kind of measures of perception in the survey, but there were some measures that were found to be correlated with knowledge. For example, those who reported having knowledge more commonly had the correct belief that generics work as effectively as the originator medicine, and similarly, those with reported knowledge were more likely to correctly believe that generics are not cheaper due to different ingredients. Moving on to the qualitative methods, so my focus group and in-depth interview results, these were thematically analyzed after I typed up all the transcripts, and these were the 5 main themes that I came up with. So I'm just going to kind of detail each of those now and show you a few quotes that the participants said. So origins really gets at how the place that people are from affects their preferences and attitudes. And the main thing here that we noticed was that there were a lot of references to alternative medicine, home remedies, and homeopathic medicine. One participant said their parents will look for other things instead of resorting to medicine. So this was often, when I asked them, what kind of medicines do you typically use, generics or branded, they say like both of those are as a whole just not as desirable as an alternative form of medicine, which I thought was really fascinating. Next, we have knowledge. So not only where their knowledge comes from, but also just the fact that most frequently their knowledge was wrong, even though these participants had already taken the survey, which showed them the definition of generic medicine. So ideally, they would have kind of already picked up on that, but a lot of the participants still displayed a lack of knowledge. This quote is basically equating generic medicines with over-the-counter. The participant saying that at home, like, her parents know about generic medicines as opposed to prescription, which she would get from the doctor. And that was a really commonly held view. People think generic means over-the-counter, which is not true. Next, we have decision-making factors. So this was when we asked people, what are the most important things you consider when you choose which medicine to buy or use? So overwhelmingly, doctor's recommendation was the most important thing people considered, regardless of nationality. And you can see in these quotes that it's ranked above brand, price, dosage, really everything. Price was another main factor, but not more than doctor's recommendation. Next, perception of self and others. So this one I thought was really fascinating. So especially the first quote. I think just like the suspicion of why is it cheaper, you could feel that there are some other effects they're not telling you about. So people sort of thought that since it was cheaper, there's no way it could be as good because that must mean that, there's less quality or whatever. So this was something that I thought was really interesting. Next, we have information sources. So we asked people where they thought information should be dispensed in order to mitigate all of these misconceptions. And since doctor's opinion was frequently cited as one of the most important decision-making factors, that kind of correlated to this answer as well. So a lot of people said that if their doctors would explain it more when they get medicines prescribed or just, at checkups or whatever, that would be effective. And then also in schools, a lot of people mentioned that if they were taught this in health classes, that would kind of help their knowledge base as well. So a couple limitations, recruiting representative samples, obviously. It would have been great to have a much more kind of international spread, especially in the survey participants. But again, that was kind of mitigated by the fact that I could hand select my qualitative interview participants, and also poor timing of the survey distribution. So I sent out the survey right around finals time in December to the student groups, so it definitely was asking a lot for them to get back to me in a timely way and also, ask their members to reply. So a couple things there. And then our two main conclusions. One is that future research should always require participants to define generics in an open-ended question so that they can assess knowledge on a consistent rubric. And second, prescribers and health curricula in schools could play a valuable role in educating consumers. So those were kind of the main takeaways. And I have about 3 minutes for questions if anyone wants to know more. But yeah, thank you. Steve.
I'm just wondering, when you were talking about one of the issues was actual trust of generic medicines and not knowing where they came from, did you see if there was any link between that and that country of origin of the person you were talking to? There was an issue with people from countries where the vetting process for drugs is not as rigorous, or go off of Lulu stuff where substandard drugs are an issue?
Good question, and that's something I really expected to see, especially because I interviewed 5 people who had parents that immigrated from India, and that's a large problem in India, but that didn't come up at all, which was really fascinating. I don't think I mentioned this, but the overwhelming theme from the participants with parents from India, and as well as one from Latin America, all mentioned the alternative medicine kind of approach as like why they didn't really like generics. Yeah, hopefully that answers your question. Yeah.
Could you give an example of, the open-ended questions, an example of where the participants' response to generic medicine was rejected?
Yeah, sure. So our rubric basically said it was correct if they used words like same as, equal to, equivalent, and incorrect if they said something like similar or I forget exactly what the rubric said, but if they said almost as good but just a little different, or a lot of people said over the counter is generic, or like if I don't get it from the doctor it's generic. Those are probably the most common incorrect answers. Yeah.
I was just interested in people's justification. Like, did people have much in-depth justification? Did you even do follow-up questions about holistic medicine, and whether maybe the fact that there is a very in-depth knowledge about perhaps the corruptive influence of money and pharmaceuticals as brand name pharmaceuticals being prescribed by doctors for patients as a way of making money within their own vested interest? If like people who responded, like my parents go to holistic medicine, that there was more like there was almost there was too much knowledge that was informing that decision as opposed to a lack of knowledge, because I feel like it's framed as if, I mean, did you get that feeling like, I'm just worried that it's framed like holistic medicine is somehow
bad,
worse.
Yeah.
You know.
So I have like 20 seconds to answer that question. I feel like there was a lot there. But really quick, we didn't really get into a big dialogue about the value of holistic medicine. A lot of people did bring up their distrust of the pharmaceutical industry. One of my participants from a country in Europe said that he doesn't trust anything here because he thinks like it's all pharmaceutical influenced. But I wasn't really able to get into like a huge discussion about the value of holistic medicine versus traditional allopathic medicine. But I can talk to you more about that too after. Okay, thank you guys so much. You're the best.